Hi guys, so I wanted to make this video today to talk a little bit about the diastasis recti split. So your stomach muscles, you have these two muscles along the side that normally have that six-pack look. So there is a little split between them. And sometimes when you're pregnant or when your stomach grows, that split gets bigger. Then we also have this muscle way down here called the transverse abdominis. So that muscle runs all the way across our belly. So if we strengthen that muscle, it will help to pull these upper muscles together. And I also want to let you know, so if your split is more than 2 finger width, then you want to do these exercises. But you should also ask your doctor and have somebody look at it because I can't look at it and I can't tell if it's really severe or what it's like. So you should get it checked out. So the idea with getting the separation back together is to strengthen these lower muscles called the transverse abdominis. And this is really a good muscle for anybody to strengthen. It's really good for your core and for your posture. So the first thing you're going to do, you're going to lay on your back with your knees bent. So there's usually a little space in your low back depending how much of an arch you have. But all you're going to do is a pelvic tilt. So you're just going to push down with those stomach muscles and try to push that hand underneath your back. Hold for about 5 seconds and relax. And then do that again. Push down and hold and relax. So when you're first starting, you can do this for holding for about 5 seconds, and you can progress to longer, holding for 10 seconds. So I want you guys to try that. And you can also do this move in sitting. So when you're here, all you're going to do is sort of tighten that lower stomach muscle and push it in. So you can do this anywhere. So this is the first exercise that I want you to work on and to get better at. And you're going to do this one for a long time till we start to see those muscles come together. So once you progress from there, you're going to do your pelvic tilt. So I'm pushing my stomach down, and then I'm going to slide a leg out and back in. Then I'm going to relax the stomach muscle. I'm going to do it again. Pelvic tilt. I'm holding as I slide my foot out and back in, and then I finally release those muscles. So that's one way to sort of progress the pelvic tilt and move on. You do want to avoid planks. You want to avoid doing anything cross. And you also want to avoid a sit-up because when we just do a sit-up like this, that's going to use those upper muscles and that's going to pull it apart. So you even want to think how you go to get up because normally, I just get like this and I'm using those upper stomach muscles. So you sort of want to go on your side and push up to get up. So think about this when you're getting out of bed or anything like that. Let me think. If you want to look up, there's something called the Tupler Technique. And she has a great program out there for people that have a diastasis recti split. There's also a bunch of other programs. So depending how severe your split is, you might be able to do these pelvic tilts and it might be able to heal. But if it's a pretty severe split, you might need a little more help. The Tupler Technique also uses a splint that sort of helps to hold those stomach muscles in. All right, so let me know if you guys have any questions. You can post it in the group or feel free to send me a private message. All right, hope you guys have a good day. And do these exercises for this whole week so you're not going to advance past this. You really have to stick with basics for a while. And one other suggestion is to do Kegel exercises where you squeeze those muscles because typically people who have a split, they'll also have weak pelvic floor muscles. So you really want to strengthen those because they do work together. All right. So have a good day and stick with these exercises for the whole challenge. And you can sort of progress yourself by doing a little bit longer or a little bit more. All right. Have a good day.